let's start with the Surgeon General. Surgeon General has come out and declared climate change a public health emergency. He has also claimed that racism is a public health emergency. Now, when you have a public health emergency, i.e. COVID, the government can claim all kinds of powers. If it's a public health emergency, they're using this language very, very carefully. Now, here's what he said yesterday. Cut 4, Surgeon General announces firearm violence being a public health emergency.
Today, for the first time in the history of our office, I am issuing a Surgeon General's advisory on firearm violence. It outlines the urgent threat firearm violence poses to the health and well-being of our country. As a doctor, I've seen the consequences of firearm violence up close in the lives of the patients I've cared for over the years. These are moms and dads, sons and daughters, all of whom were robbed of their physical and mental health by senseless acts of violence. Unfortunately, the problem has continued to grow. The Surgeon General's advisory lays out the approach we can take to address firearm violence as the public health crisis that it is. This includes implementing community violence prevention programs and firearm risk reduction strategies, improving access to mental health care for those exposed to or at risk for firearm violence, and expanding research funding to inform and evaluate our prevention strategies.
Hang on just a second.
Firearm violence
Hold on. Did he just say that it would expand mental health access for those who have created gun violence or who had participated in it or had access to guns? It's interesting. Anyway, so there's Dr. Murthy coming on, and he says, I just want people to walk, through their neighborhoods and feel safe. Yeah, so do I. What's changed? Why has it gotten so dangerous to walk through our neighborhoods? There's some other things that are going on that I would call a crisis, but he doesn't want to talk about that. He wants to talk about the evil gun and those who want guns. And it's a public health crisis. Now, let me give you another story before I get into the main point here. Delaware, the state legislators yesterday sent doctor-assisted suicide bill to the governor to sign. This would be the 11th state to approve doctor-assisted suicide. Okay, let's look at those 11 states. What 11 states has doctor-assisted suicide? California, Colorado, Oregon, Vermont, New Mexico, Maine, New Jersey, Hawaii, Washington, and Washington, D.C. Stu, I'm noticing a pattern here, and I don't know exactly what it is. What do those 11 states have in common?
Great vacation locations?
Nope.
No?
No. I wouldn't put New Jersey in the same category as Hawaii.
Really?
Yeah. They're all the most progressive states we have in the union. Okay? So they're the same ones that are fighting for the death of babies. They are the same ones that are now going to the opposite end and saying also the death of old people or anybody sick that wants to die. Okay. All right. Now let me tie these two stories together. May I? Have you ever heard anyone tell the American people that this is science and those that don't understand it are going to be swept aside in history as those being on the wrong side of history? Have you heard anyone saying, well, to, kids, you understand things that your parents don't understand because, well, they don't get it. It's a new generation, right? Have you ever heard anyone saying, if you don't join us, you're against us, right? Okay, let me read something to the doctors in medical profession from Dr. Wagner. Colleagues, sweep aside all those who do not wish to understand the sign of the times. Over the course of these weeks, it has been with emotion and gratitude that we have observed the German national awareness of itself and the value of its blood. In every hamlet, every walk of life, in all the professions, we are witnessing the awakening of the people and rejection of mistakes coming from liberal and foreign elements. When they say liberal, by the way, they mean classical liberalism. They mean that you as an individual matter, not the kind of liberalism that's now being preached. Liberalism meaning you have an inherent right to choose for yourself. Let's see. He says, a few professions participate in the grandeur and the future of this nation as much as the medical profession does. And none is so rife with the Jews nor hopelessly invaded by foreign thinking. Now, you could say, well, I mean, in today's world, we're almost there saying the Jews here in America, but you could also say, instead of foreign thinking, MAGA. People who believe in the Constitution, that believe that we are a republic. The PhDs that are Jewish hold the leading chairs of medicine in universities. They are sterilizing the medical art and impregnating generations of young doctors with a mechanist way of thinking. Okay. They've already taken care of this in the universities. And anybody who is a conservative is talked about like that. They don't get it. They're living in the past. They hate people. They hate children. They are a threat to our democracy, right? Jewish colleagues sit at the places of honor in doctor societies and associations. Now, again, this one they've already taken care of here in America. There's no one who is a conservative that has been honored and is sitting in high places in any of these organizations. They're making a trumpery of the honor of the medical profession as they are systematically annihilating our code of ethics. Do we have two set of ethics in this country? I think we do. I think we have the progressive code of ethics and then the traditional American code of ethics. Let's see. We are indebted to them for ever-growing mercantilism, meaning capitalism, unworthy of our profession. So capitalism shouldn't play any role. Because of it, we shall be impoverished. Our credit with the people will collapse. So because of capitalism, the people will be impoverished. You can't have that. You need a socialized system. Have we heard that from anyone? German doctors, this we know. Those responsible for the situation are foreigners. They alone have led us this way. They have been opposed to any German thinking in our organizations. So could that be said by people who are MAGA or people who are constitutionalists or people who are classical liberals? Yeah. We've been opposed to any of this new think in all organizations. But we have welcomed every Marxist proposal, but they have welcomed every Marxist proposal and every Jewish member or measure that came along. We have not. We have not. They have. That the medical profession should constitute a Judeo-Masonic enclave at the heart of Germany cannot be allowed to happen. Honor and sense the duty that obliges us to put an end to this scandal. It is for this reason we are appealing to the entire German medical profession. Clean up the administration of our organizations. Sweep aside all those who do not wish to understand the new way of thinking. Does that sound familiar? For we wish to work together towards the reestablishment of a new medical profession for the welfare of the people and the honor of the German doctor. Okay, so the medical associations listen to this, and then they begin to socialize the medicine, and that's when they get into euthanasia. And it's a public welfare project. That's what this is. It is for the good of the German people and those who are suffering. Okay? They're just unproductive people, and they're suffering, and we should help them meet the Lord. Now, they go on, they start liquidating people. People become suspicious. What does the government do? The government comes out and says, we're not doing any of that. That's not true. Does that sound familiar? How many times have we heard, we're not doing that? That's not true. That's a conspiracy theory. And even Hitler himself comes out and says, this is an affront to the German ethics. We are not killing children in. Behind the scenes, that's exactly what they're doing. Then they start a new campaign, and they start to go after the universities and culture, and they start producing movies and films that are showing how insensitive it is for you to judge people that want to die. And there was a new movie that was released by Goebbels from propaganda called I Accuse. And this was about a doctor whose wife was dying, and he gave her, life-ending medicine out of compassion, and he was prosecuted for it. Persecuted is the way it is made to believe in the movie. And he says, you accuse me of this? I accuse you of having no heart. Euthanasia becomes popular, and there's new passports for death. And then they develop public-private partnerships for death. For instance, the charitable organizations that would take old people and children out of the hospitals and kill them. It was the Community Labor Service. It was the Nonprofit Association for Financial Questions. It was the Patients Transportation Corporation that did all of these things, not the government. Oh, surely not the government. They created a system where the scariest were not the black-coated SS officers. The scariest were the ones wearing the white coats. It was the doctors and nurses that first laid all of the foundations for what the Nazis are best known for. I warn you, you cannot make medicine political. You cannot take political matters and bring them in to the system of medicine. But that's exactly what we're doing. And may I ask, do you think you or your family can afford, in every way that is meant or conjures, can you and your family afford another 4 years of this?